This conference will now be recorded.
Hello students, I'm Dr. Zibia from TeenEinstein. So now we are learning about why do we fall ill. This is 13th chapter in 9th standard and this is your third part. So in this chapter we are learning about health and its failure, then diseases and its causes, then about infectious diseases. So we said already like this health issues nowadays in community, it has become a very big issue. Right. So what is health and how this activities and this health, everything is interconnected, and our body, see, one part of our body that is getting infected or some health issues are happening to a particular part of our body, it is affecting the whole body, and sometimes it may lead to death also. So why it is so? See, just it is getting infected, like some kidney or lungs, one part is getting infected. How our whole body is getting tired, or how it is getting affected, the whole parts of our body, because all these are interconnected, right? So health and its failure. In that, while talking about that, we have discussed about the significance of health, right? See how we can say that we are healthy. There is no disturbed condition in our body. Everything is going smoothly and everything is going well. That means we are healthy. Like we have an attitude like it's we can say that, yeah, I'm healthy, I'm good. So that quite frequently we are using that term, right? See, we used to tell my mother's health is not good, or my teacher is not feeling well, like that we used to, or we used to write leave letter, right? Due to health issues, I'm not able to attend the class. So like that, we are more, or we are more concerned about our health. So there is like an idea like being well, right? That means that is the effective functioning of our body. What is that? Effective functioning of our body. So our body, there is no disturbances, like there is no interruptions for the smooth functioning of that body. That condition is quite called as what? That is called as healthy situation or healthy condition. So health means that is a state of being well enough to function well. Okay, so for the well functioning of our body, some conditions are required. That state, if our body is in that state, means all the functions of our body, everything is going smoothly. That is called as what? That is called as healthy condition, or we are healthy. We can say that. And that may be mentally or physically or socially. Okay, all these things will affect mental health. Healthy means mental, physical, and social conditions. All these, see, mentally, if we are disturbed, we are getting angry, or some due to some reason we got scolding from someone, we'll be angry. So that is this mental state, right? So that mental state, physically we are doing something, means we will not be able to concentrate in that. So that mental condition is affecting our physical work also, right? Isn't it? So that means all conditions, mentally, physically, and socially, we should be in a good condition so that everything will go good and well. So that condition is called as a healthy condition, right? Then we said personal and community issues, both matters for health. Personal and community issues, both matters for health. That means the physical state or mental state and social well-being, everything is interconnected. So it's like we can say all these. Just now I said any state like physical state or mental state or social state, anything is getting disturbed, that will affect the health also, right? So the environment, that is having a major role. That includes the physical environment or the environment which is including the physical environment, that is playing a, or we can say that our surroundings, that is playing a very big role in the health of a person or an organism. Okay, see, for that example we said like human beings, they are living in societies, and also there, if some garbage issue comes, what we will do? If there is no proper collection or dealing of this garbage, and you're simply throwing that to your surroundings, that may be like bit far from your place, just maybe 1 or 2 kilometers or 5 kilometers away from your place, whatever it may be, one day it is going to affect you also, right? So all these maintenance of the surroundings, that also, that if you are not maintaining that well, that will lead to the poor health conditions. Okay, so therefore public cleanliness, that is very important for individual health. Public cleanliness, that is very important for health. Okay, then we said about the distinctions between healthy and disease free condition. Healthy condition, the first we discussed about health issues, then health and its failure, then personal and community issues. The next point we had discussed, that is healthy condition and disease free condition. Healthy and disease free. What is the difference between these? What do you mean by health and what do you mean by disease free? See, actually we can think like disease means disease. What do you mean by disease? That is a disturbed condition of our body, right? So in this condition, if our body is getting disturbed, that means we will become uncomfortable, right? So there is a particular cause for that discomfort. So that doesn't have a meaning that that is the final cause of that disturbance. We can say some like somebody is suffering from diarrhea, and they don't know exactly what is the reason is. That may be from food, or that may be due to some other. See, if you're taking some food already that expiry date over, so that may lead to the poor that diarrhea condition. Or sometimes there may be some other issues, like there may be some internal microorganisms, their attack or entry of some microorganism which is leading to poor health condition or diarrhea. So that everything may cause that diarrhea. So we don't know, the condition is our health is getting disturbed, that the person is in a condition of diarrhea, but we don't know the exact cause, what is the final cause of that. Okay, so now we can see easily that it is possible to be in poor health without actually suffering from a particular disease, right? See, for each and every person, good health is very important. Like if one person, for a sportsman, definitely he should maintain a good health, or for a dancer or a singer. So all are maintaining their health, whichever is required for their profession, that they will be trying to maintain, right? So they have the opportunity to have that opportunity to realize the unique potential in all of us. So if our body is not working, or due to any reason, any part of our body is not working, that we said it's already everything. Our body, it is a combined, like all functions are going on in a connected way, right? It's not a single organ working in our body. So many organs and organ systems are working. One cell, basically one cell is working, then it is moving to the tissue level, then to the organ system, and that makes a complete body. So how to make that in a complete healthy condition? So anything is getting affected, maybe external or internal reason, or mental reason, or physical reason, or maybe a social reason, whatever it may be, that healthy condition is getting disturbed means that will affect the whole body, right? So each of the organ system that is having a specific, or mean it is having specific function. So if our digestive system, that is having digestive system, we are saying the whole digestive system, there is a stomach, intestine, everything is included in digestive system. So all these are helping to digest the food which is taking from outside the body, right? So if any part, if stomach is getting upset, or the food which we are taking is not good, that will affect the whole digestive system, right? So our health is getting disturbed there. So when there is a disease, either the functioning of one or more system of the body that may get affected, or our whole body may go worse, in a worse condition, right? So signs of disease, even if you are approaching on physician, they will look for the basic things first. The treatment, suddenly they won't go to higher level treatment. From the basic issue, they will try to find out the basic issue, each and everything they will ask, and from the basic level they will start the treatment, right? So physicians, they will also ask for laboratory reports and other whichever is required for your particular unhealthy condition. They will ask everything, and they will start the basic treatment first. Okay, if there is no result for that basic treatment, they'll go to the next step, and finally they'll reach to the higher levels. Then we had discussed about acute and chronic disease. This acute means it will last for few days, right? See, there is a difference, like manifestation of diseases that will be different depending upon the number of factors. So some disease, they will last only for a short period, and those kind of diseases are called as acute. And chronic disease means they will last for lifetime, or maybe for long time or lifetime. Sometimes it may last for whole lifetime. So such diseases are called as chronic diseases. Okay, and the chronic diseases that we have different types of effect on our health. Okay, like here the chronic disease that may be affected to some part of our body, but it will affect our whole health, because functioning of the body, that is getting disturbed for a long time. So finally, it will affect the whole body, right? So the major health issues will happen due to this chronic diseases, because it's not for 1 or 2 days, and the health recovery from that acute disease means it will last only for few days, and if you're having proper food and medicine, your health, you can recover from that, and you will get back to the good and healthy condition. But chronic diseases are not like that. Chronic diseases means, first of all, it is long time diseases, or sometimes it may last for the whole lifetime. So if you are getting infected with a chronic disease, like tuberculosis of lungs, then for that will last for years, and their weight loss will happen, and all other weight loss means definitely you are going to a poor health condition. So that will affect the whole life and the whole life processes. Okay, so recovery from that, it's quite difficult compared to the acute disease. Okay, so let's discuss the causes of diseases now. See, what is causing these diseases? Or what causes disease? See, when we are thinking about the disease causes, we must remember that there are many levels of such causes, right? There are many levels of causes, right? Sometimes it may be the basic reasons. If we are solving that issues, you can recover from that. But sometimes it may not be so simple as you are thinking. Okay, but and in the case of some diseases, you can easily say that, like, some diseases, if it is there or our health condition is getting affected, it will not show very easily. It will show simple symptoms. Okay, so you'll think that, okay, you are getting tired because of that, due to traveling or something you'll be thinking. But if it is lasting for many days, don't take it so simply. Don't think that your health is not getting it. It is the common reason, or climatic change. Don't take it as a simple symptom. Okay, so we must remember that there are many levels of such causes. Like, for example, if one baby is suffering from diarrhea, okay, baby is suffering from diarrhea or loose motion, we can say. So there are different causes. We can say that the cause of this loose motion, that may be some infection, right? But here we are saying the first may be due to some infection, we are saying. But next question, what is the next question? Why did the infection come, or from where that baby got the infection? Next question is why or where. From where did the baby get that infection? Suppose we find the infection came through some drinking unclean water, and there are, see, our baby is in a play school. Okay, there's several, like nearly 10 or 15 babies are there. Only your baby got the infection. Many babies must, they have had this unclean drinking water. So that day, the water which they gave from the play school, that was not clean. But only one baby got the infection. Why? That's the next question. So why is that one baby developed loose motion when other babies did not get that? What is the reason for that? Just think. So one reason we can say that that baby is not healthy. See, suppose there are baby A, B, C, D, all these are babies. So baby A got infected. Okay, this B, C, D and all, they didn't no infection. See, the reason one baby got infected, we can say a simple reason that that baby is not healthy. Okay, one reason is that baby is not healthy. Okay, so if one baby is not healthy, when it is getting exposed, so the already the health condition is disturbed. Okay, so that baby, when that baby is getting exposed to unhealthy conditions or risky conditions, what will happen when they are getting exposed to risk, not healthy, then exposed to risk, there the chances are more to get infected, right? But the healthier babies, there is no infection for them, chances are more. Which one? For that unhealthy baby, when that unhealthy condition, again they are getting exposed to risky conditions, there the chances of getting infected, that is more. But the other babies B, C and D, there is no infection, that means their health condition is quite good, right? So when they are getting exposed to risk, there is a less chance. Okay, healthier babies have less chance to get infected. Why is the baby is not here? Next question. Here we said not healthy. That's why when exposed to risk, that got infection or loose motion. Okay. So here, next question comes, why the baby is not healthy? This is the question. Why baby is not healthy? Because that baby is not getting nourishment. Not getting proper nourishments, like proper good good and complete food, it's not getting to boost up the immune system. Okay, so that may be one reason. See, all these are quite natural things which I'm explaining, right? We are getting infection and our friends are not getting infection. Why? When we are getting infected, there is or our health is very poor, there is a chance for other diseases also, right? At the same time, when we are in a healthy condition, if we are getting exposed to risky condition also, we can escape, we can save, right, ourselves, because our immune system may be working properly. Why we are not healthy? Our health is not good. Why? Because we are not getting proper nourishment or lack of good nourishment. That becomes the second cause or the next cause of disease. Okay. Then why that baby who got infected, whose health is not good, who is not getting proper nourishment, why that baby is not well nourished? Because that baby may be from a poor condition, poor family background, right? That may be one reason. See, when we are looking at our society, we can see people with different family backgrounds, right? Just imagine our 10 friends. They'll be having different backgrounds, 10 different backgrounds, right? So the poor family background, that will not be allowing them, or that will not be giving them a chance to give proper nourishment to that baby. So that may lead to a poor health condition, and that may lead to chances of more risk, right? So there is also one more possibility, that the baby has some genetic difference that makes it more likely to suffer from the loose motion when exposed to pathogen. Okay, This is the first chance. Maybe from poor family background, they culture. Okay. they don't have enough money to feed nutrient food materials to that baby. That is one reason. And getting from loose motion condition, then if you're going, you should getting affected. So without the lead to respiratory causes, we cannot, without the disease condition. Pathogen means first a family background or both won't pathogen, the baby didn't need. That is the thing. The immunity is from poor family, also poor genetic condition pathogen that these both loose motion, but entering in our genetic condition are affected. Pathogens to end. Another important that baby that is service, not poverty. Third reason, not healthy due to genetic family or the public or lack of public service. So cause and immediate. See, if I'm getting, that's why whenever one, first of all, or pathogen or definitely, so their healthy situation causes there, and so for a is or that may be the poor generation or poor immunity reason, right? So to unhealthy issues, cases will have made clear. Then in causes. See, we said like public health, keeping public health, that is very important, and that is affecting our public health, right? This is very important, and that is affecting the health of community health factors, right? So we need to think, or we need to keep all these things in our mind. So when we think about the causes of disease, it's important to keep public health and community health, right? See, first about what we need to think, the immediate causes of diseases. Immediate causes will be there, then the contributory causes also will be there, right? So there will be immediate causes, which is becoming the sudden reasons for that disease. Okay, then contributory will be there, which is adding or which is supporting for that disease. Okay, so here first we need to concentrate, or first we need to think. It will be useful to think about the immediate causes of diseases, because there are two groups of diseases, which is that one is infectious disease and another one non-infectious diseases. Infectious and non-infectious causes. Okay, so one group of causes is the infectious agents. Okay, so for disease, a disease is causing due to several reasons. One is infectious agents. Okay, and these infectious agents, they are microbes or microorganisms. Microorganisms. So diseases where the microbes or the microorganisms are the immediate causes, they are called as infectious diseases. Okay, so infectious diseases means there are some infectious agents. Mostly it is the microorganisms. So the diseases which are caused, or for that disease which are the immediate cause, they are called the infectious diseases. So this is because the microbes can spread in the community, and that disease they cause will spread along with the organisms, these microorganisms. See, microorganisms, they can spread in the community. Right? See, if you are not doing, just like we said, one example like garbage maintenance. So if you are not doing that, if you are throwing that garbage in your surroundings, definitely that vegetables, everything will be there. Vegetable waste will be there, and all food items, that waste will be there. So every microbes lifespan is, or their life cycle is very short, so they will multiply very fast. So these microorganisms, when they are multiplying there through air, they may spread, right? And through some flies they can spread, and suddenly there it started raining. What will happen? Through water it will spread. So it can spread in the community, so that the diseases which is caused by those microorganisms, that also can spread along with them, right? Then there are some other diseases. Infectious diseases means mostly their infectious agents are there. They are microorganisms, and when the microorganism is spreading in the community, along with that, that disease also will spread. Okay. On the other hand, we can say there are also diseases which are not caused by infectious agents. Not by infectious agents. Okay, they are not caused by infectious agents. So their cause, that may not be like microbes or such kind of external causes, like how they are spreading with the along with the microorganisms. So this non-infectious diseases means it may not be like the microorganisms or such reasons. Okay, their reasons may be internal reasons. So such diseases are called as non-infectious. For example, we can say cancer. See, this cancer example, we can say cancer, non-infectious diseases. This cancer, that is not due to some microorganism, that is due to some genetic abnormalities, right? Causes of cancer, different types of genetic abnormalities. Okay, so then another one like high BP, high blood pressure, that is due to lack of exercise or excessive weight or whatever maybe. So many other diseases which we can say that many diseases are there which may not spread very easily. So those kind of diseases are called as non-infectious diseases. Okay, so here the way in which the disease spread and the way in which they can be treated and they can prevent at the community level, that will be different for different diseases. Okay, so that depends upon whether the immediate causes, whether the disease is infectious or non-infectious, right? See, we know that any viral fever it's coming means it will spread very easily in our community, right? See, dengue fever, like dengue fever, mosquitoes. Mosquitoes are growing, and one particular, not all the mosquitoes, one particular type of mosquito that is spreading the diseases, right? Dengue fever. So such kind of diseases, infectious diseases, their agents are there, and these agents, microorganisms are there, and that can spread in our community way in a very faster way. But the non-infectious diseases, there is no infectious agents, there is no microorganism, and the reasons may be internal. Okay, so for that example, we are saying cancer is the best example. We know that if one person who is having cancer is coming and sitting near to us, it will not spread, right? It will not come to us because there is no agent or microorganism which is causing the cancer. That is due to, we can clearly say that it is due to genetic abnormality. So that person's genetic condition, genetic abnormal condition will not pass to us. At the same time, if you are going to one hospital for consulting one doctor and the person who is sitting next to us, or if you are traveling somewhere, we are traveling by train. So the person who is sitting near to us, he is having fever and he is sneezing. Definitely, because you are traveling for 2-3 hours. Definitely, if that person is sneezing 10 times, the people who are sitting nearby, they'll get the disease if their health condition is poor. If they are old people or small babies, definitely those will get, because their immune system will be weaker compared to the healthy people, right? Old people means their immune system is going weaker. Day by day, it's going in a weaker way. And in a newborn baby, the immune system is getting developed, right? Every day as the baby grows, the immune system also will get developed. Okay, so that will take time to get stabilized in that baby. And in the older people, they are losing that immunity. Okay, so when they are getting exposed to a person with such kind of infectious diseases or like fever, cold and all, due to their unhealthy condition or their weak immune system, they will get the diseases. At the same time, one teenage person who is having healthy conditions and who is having good body and good health issues, good health conditions and all, his body can prevent that infection because his immune system is good and his health is not at all disturbed. He is in a healthy condition, so he can fight against that microorganism and his body can prevent the entry of that microorganism due to good immunity. Okay, so different conditions are there. If our health is not disturbed, we can fight against this infectious diseases. But if our health is getting disturbed, or whether it is in a developing stage or it is in a weaker stage, in that stage chances are more. So there are two types of diseases, infectious and non-infectious diseases. So first we will find out the immediate cause of the diseases. Non-infectious means there is no infectious agents and the causes are internal. Okay, that may be due to genetic abnormalities or something like that. Okay, so such diseases will not spread in our community. They should get such diseases due to their own reasons. Okay. But infectious diseases means infectious agents are there. These agents are microorganisms and they can spread in the community in an easier way. Okay. So first, for everything, for infectious diseases, to prevent the infectious diseases, public cleanliness, that is very important, which is helping to keep the public health and community health factors. All these things we should keep in mind and we should bring into our actions everything. Each and every person is ready to change means definitely community will change. Okay, so that's all about this part. In the next part we'll be learning about infectious diseases. Okay, thank you.